Yeah, thanks for the folks that have started to put their convos in the chat. Good evening, good afternoon to everyone, no matter where you're joining from. We're excited to have you here. Okay, I think we have achieved critical mass, so we can go ahead and get started. So, for those of you who don't know me, my name is Anjana Sridhar. I am one of the members of the HLNY Diversity Committee, and this is our first ever health equity qualifying event that we're doing as a committee, which is very exciting. Before we get started, just wanted to share a few housekeeping tips and a quick introduction of myself before we introduce our esteemed speaker today. So, just for everyone's awareness, this event will be recorded. So, just please keep that in mind. Please keep yourself on mute, all of that fun stuff. And also, a special shout out to Marjo Jean, Maxine Legal, and Kirk Castillo. This event would not have been possible without their support. So, thank you all so much for everything that you've put into making today possible. So very quickly, a quick introduction about me. My day job, I am a project manager at an academic medical center here in New York City, working in the oncology space. So very excited to be joining you in that capacity and also as your moderator for today. Very quickly, want to introduce our speaker, Errol Pierre. Errol Pierre is a SVP of State Programs at Health First, leading product sales and community engagement. He's also a published author, a college professor, a healthcare executive. He graduated from Fordham with a Bachelor of Science in Business Administration from NYU and a Master's of Public Administration in Health Policy and Financial Management, also from NYU. And last but certainly not least, he also has a doctorate in business administration from Baruch College. He's an adjunct professor at universities such as Columbia, NYU, Baruch, teaching health economics and health transformation, and also serves on the board of the Citizens Budget Commission and Arthur Ashe Institute of Health. And if, in case that's not enough, he's also a published author of the book, The Way Up, which is also what we're going to be talking about today. The full title of the book is The Way Up, Climbing the Corporate Mountain as a Professional of Color, published by Wiley. Errol, thank you so much for taking the time to join us today. We're really excited to have this conversation with you.
Thank you for having me. Excited to be here and ready to jump in.
Amazing. So, first things first, we really wanted to just get started by learning a little bit about your background and your story. So, where did your leadership story really begin?
Great question. And one, thanks to the committee for putting this together. HLNY is a great organization. Anyone who's listening that hasn't joined, I urge you to join. That's my plug. Um, so great question. I think, ironically, people think leadership starts with a title like manager, director, and vice president, but my leadership story began in a dojo in Spring Valley, New York, teaching karate to young kids. I grew up watching Teenage Mutant Ninja Turtles, being inspired by the Blue Ninja. That was Leonardo, for anyone who doesn't know. And that inspiration led me to start karate in the first place. Ended up getting my black belt, and then I became what they call a senpai and teaching classes. And so that was where I learned leadership first. And teaching that class led me to helping a young kid. I talk about this in my book, that had issues with discipline, didn't have self-esteem, didn't have self-control. And by working with him through the classes, teaching him behavior changes and discipline and all of the kudos that go into what makes a really great karate student, his father was like so surprised at his behavior change at school that he came to thank me. And that discussion actually led to my first paying job. So teaching karate was part of my giving back to the dojo. I didn't get paid to do it, but then by helping this kid, his and meeting his father who owned a company, he was the one who got me my first job. Uh, since it's just the two of us, I'll tell you a secret. My first job was like $6 an hour when I was 17 years old. And so that first job was working in a warehouse of a beauty supply store, stacking shampoo bottles, packing and unpacking boxes, and helping a truck for delivery. So I'd say leadership started back then when I was a kid teaching karate.
Yeah, absolutely. And that's such a strong reminder that you don't have to be a certain age or have a certain credential to actually consider yourself a leader. And so I'd be curious to hear a little bit more about, all the things that you learned along the way to help empower you to realize that you could be a leader at any age. But before we get to that, you also mentioned this in your book briefly. You talk a lot about how you were taught about success by your family, and you come from a family of immigrants, and the way that they kind of educated you on what it means to be successful, and how that might have changed, how that story of what it means to be successful has changed along the way. So would love to hear a little bit from you, what you learned from your parents and from your family about what it means to achieve career success, and how you yourself learned about what success looked like moving forward.
Yeah, it's actually a great question. So let me start by saying that my dad is my hero. His name is Stuart Pierre. Both my dad and my mom grew up in Haiti. Right now, it's one of the poorest countries in our hemisphere. And my father somehow figured out a way to come to America in 1969, fleeing a dictator that was actually killing his own Haitian people. His name was Baby Doc. And once he came to America, he brought my mother over, started a family, and my dad absolutely experienced the full immigrant experience in America. That's racism, that's prejudice, that's people assuming that an accent means you're less intelligent, that's perceptions and even the misconception that, and this happened in 1980s, that Haitians brought AIDS and HIV to America. Like that was the
Right.
America he knew, all
Right.
that combined. So that's where the lessons came from. So his view of America was very, very different than mine. And the lessons I learned in the home, and it wasn't verbal lessons. This is just through observations.
Right.
They didn't teach me this. It's just by the behaviors that I saw was keep your head down, don't make waves, don't ask for a raise, don't ask for a promotion, stay at the same company for 40 years, let your work speak for itself.
Mhm.
Working hard will lead to you being recognized. Don't take risks. Don't take chances. Like literally, it was like Errol, just blend in. That is the
Right.
loudest lesson I got from my parents, and I understand where that came from.
Right.
Um, that's diametrically opposed to the lessons I learned once I got into corporate America.
Mhm.
So I'd say in today's environment, those lessons don't work. You can't keep your head down and just do your job. You have to look up and anticipate what's coming and modify your strategies to remain effective and relevant. You have to make waves. So if you see something, say something, just like MTA says. People who join meetings, we join these Zoom calls, and we never say a word. We're missing out an opportunity for people to hear what you have to say,
Right.
for bosses to find out who their next hire is going to be or their next promotion is going to be. So if you talk and say nothing, sometimes that ends up staying where you are in your career and you get stagnant. And that's very important for social awareness. And then the last two things I'll say is, you know, back in the day, it was stay at a company for 40 years. Now, I think we change companies too often. I've seen people resumes and they change every 2 years. What I
Right.
would say is what I've learned through my mentors and just experiences, you have to show a body of work at a company. You came, you saw, you conquered, right?
Mm.
If you don't have a conquered story, then people are asking, are you running away from your former employer? Or are you
Mhm.
actually running to this new role? So what people are like, how long should I stay? It should be a body of work. What did you do when you came? How
Mm.
did you change the role you're in to make it
Mhm.
better? And what achievements did you have? If you can spell out that body of work, then potentially a change makes sense.
Mhm.
And then you have to speak for yourself. It's
Yeah.
weird, it's awkward to talk about yourself, but you have to document your wins. You have to keep your resume updated with stats and figures about the business value you created. And
Right.
you need to tout your success because no one else is going to be your cheerleader.
Yeah. No, I really appreciate that. And there's so much I want to respond to in that, but I realized at the top of the call I didn't mention an important housekeeping item, which is that the Q&A chat is live, so please feel free to throw in your questions, and when we get to the Q&A portion, we'll definitely be pulling from those. So just wanted to share that with the group. But going back to what you were saying just now, Errol, it sounds like I have two key takeaways. One is, it's not that what your parents shared was wrong or right. It was just coming from a very particular context. And I really appreciate how you frame that in relation to the learnings that you had once you entered corporate America. Both of these realities can coexist at the same time, and we can still learn a lot from both contexts. So thanks for sharing that. And the other thing that you really highlighted was being able to tell a meaningful story about your time at a company, at a place, at an internship to kind of say, this is the value I was able to deliver. And like you said, if you're able to structure it in a really nice tripartite way, I'm sure that's really helpful from a storytelling perspective as well. So going back to what you were saying about, your parents really encouraging you to conform and blend in, we often hear about the importance of authentic leadership, right? What does it mean to show up as your authentic self and to lead yourself and to lead others? So how would you define authentic leadership in a world that often rewards or sometimes expects that level of conformity that you were just talking about?
Yeah, great, another great question. So to me, authentic leadership boils down to one word. The word is vulnerability. And ironically, as a person of color, someone who's underrepresented in the C-suite, it's actually not the best idea to be vulnerable.
Mm,
Based on my past experiences, based on research papers that you read, and you're like, well, why? And what I've witnessed, what I've seen, what I've experienced is if you're not part of the dominant group in a social setting, then you're less likely to be open and transparent, and you are more likely to have walls up, just naturally. You want to protect yourself from what you don't know. And yet, to be a successful executive, you should be authentic. You have to be vulnerable. It starts with vulnerability. So there's a tension there, I think, as
mm,
leaders, especially if you're underrepresented. And what I'd say is it's higher stakes for me. I'll be very personal about this. It's higher stakes for me as a Black executive to say, I don't know at a
mm,
board meeting or amongst my peers,
hmm.
because will I get the same grace to not know something in the room? There might
Yeah,
not be as much grace for me to be a human being and make mistakes. So instead of vulnerability, we kind of clam up and build walls. But I will say authentic leadership starts with vulnerability. And so it's really important to get your courage, your confidence built up. You really have to manage imposter syndrome to know that you deserve the role that you got. And then begin to be vulnerable, because that's when people start to follow you. They won't follow you unless they trust you inherently.
right. No, that's a really good point, and that's an interesting polarity as well, right? Like you want people to build trust with you and to feel that you can lead them through a crisis or through any situation, but at the same time, you also want to retain your position as somebody who is a subject matter expert, somebody who knows things, somebody who can be, trusted to be relied upon by senior leaders even. So to that end, I think the audience would definitely be interested in hearing a bit more about some strategies that you've implemented yourself that have led to your success. And I mean, you've already started to elaborate on some of these, like being able to tell an authentic story about the change that you've created in a role, but any other strategies that you've used, I'm sure would be welcome to our audience
Yeah.
too.
So it's two cliche words I'm going to say that you probably heard
Let's
before.
hear it.
It's yeah, it's networking and mentorship. And here's why I say that. So think about the bias that we face in America, right? Everyone has bias. I have bias.
Hmm.
The issue we have in America is that the bias is disproportionately coming from one place.
Right.
We don't have diversity and bias at the
Mm,
decision-making levels. If we had diversity of bias, then you could check your bias, right? So if I have bias and I hire someone, someone could say, Errol, you might have this bias. They check me, and we make sure that they check that bias and we hire the right person. When everyone's the same at the top, you'd have no one to check your bias. And so
mm,
what you're really looking for is diversity of bias so that you have a check on it, right?
hmm.
So how does network come into play? The same bias that's existed for all the years we've been, a country, they use that same data to be the infrastructure for all the algorithms that we submit our resumes into.
Right.
So,
Right.
so even though it's a robot, it still has the same human bias because we're using the data of hiring to put into this computer. So to think that you're going to submit a resume
Hmm.
and honestly get a fair shot at a phone call is few and far between. And the data shows this. I mean, there's so many research papers you can pull up.
Right.
I footnote this in my book. There's research. It shows someone who is African American without a criminal record will get less phone calls for the same job, same resume, than
Mm,
someone who's white that has a criminal record because of that seeped in bias. And that's the same
right.
bias that's in the algorithm. So how do you overcome that? Networking.
Mm,
Pretty much 90% of the positions I got in my career was because the person knew me already.
Yeah.
not because the first time they read Errol Pierre and saw my resume was because an HR, acquisition, talent acquisition person put it on their desk. I don't
Right.
think I would have gotten roles to the degree
Mm.
that I had if I had to do it through Indeed.com or
Right.
LinkedIn. I
Right.
had to have a relationship with someone, and you have to build that relationship before you need something.
Hmm.
So the other thing we do, unfortunately, is once the job is posted, we say, "Hey, Errol, I saw a job's posted. I'd love to
Hmm.
meet with you." It's too late. It's too late.
Right.
Build the relationship with me and whoever else
Upfront.
before. Let them get to know who you are. Let them get to know your work ethic. Let them get to
Yeah.
know your values.
Yeah.
Then when the job opens up, they're thinking of you already. And
Hmm.
it's not awkward to reach out to them. So networking is so huge. I think we put volume over value. We go to these networking events, HLNY has them, and we're
Hmm.
like, I got 17 business cards. Get two, but make
Yeah.
them meaningful conversations,
Hmm.
really meaningful conversations. Another thing we do is we say, oh, you're in oncology. I don't want to be in that department. I don't need to meet you. Even though you're in oncology, you know other people at that academic medical center.
Right.
So let me treat you as a human being, get to know you, and I'll bump into you another day where you can help me. And
Hmm.
reciprocity, I can help you. So I think
Yeah.
network is so key.
Right.
And the second one, I'm trying to be fast, is mentorship.
Yeah.
Mentorship. I can't understate mentorship. People always wonder where the word came from really quickly. So the Odyssey was written by Homer. The
Right.
main character is Odysseus. Odysseus goes to fight in the Trojan War. He goes fighting the Trojan War. He leaves his son behind, Telemachus, and he's like, "Who's going to watch my son while I'm away for many years fighting in the war?" The person he selected to watch over his son when he was away was a man named Mentor.
Oh,
That's where the
wow.
word comes from. He's a trusted advisor. He stepped in the place of a father figure. If
Mm.
you don't have a father figure in your career, you're like lost, right? You have to be Telemachus with someone that your father gave you to kind of help shape you and grow you up, that you trust. Uh, the lessons I told you about that I learned from my parents, the way I unlearned those lessons and learned the different lessons I spoke about was through mentorship. A
Hmm.
mentor helped me in corporate America understand the ropes. Here's what you need to do. Here's how you
Yeah.
need to dress. Here's the etiquette for the culture of the office, et cetera, et cetera, et cetera. So
Yeah.
networking and mentoring, but not just the cliche word of it, like
Yeah.
actually practicing it.
Right. And also it sounds like approaching it with a good amount of intention, right? It's not about quantity, it's about the quality of the relationships you're building with people. And to that end, I really enjoyed in this portion of the book where you talk about that first paid role where you were, stocking shampoo bottles and how that led you and kind of started you on your healthcare leadership journey. So I'd love to hear a little bit more about that story and how you were able to build a relationship with a person who was then able to help set you up for success moving forward.
Yes. Okay. You're bringing me back to the warehouse. Okay. Good. That's good. That's good. Warehouse keeps me humble, by the way, right?
Hmm.
Um, so yeah, there's a chapter in my book called Shampoo Saved My Life. Um, And so I'm in a warehouse stocking shelves. In between deliveries, and this is the job I got from teaching karate. It was a pretty boring job in between deliveries. So to pass the time, I would organize bottles of shampoo. Like put the shampoo over here, put the conditioner over here, and put it in alphabetical order. After that was all done, out of pure curiosity, I used to read the back of the bottles. I was bored, right? Waiting for the next
Hmm.
shipment. So one day I was doing a delivery at the beauty salon and I brought in boxes, and the owner of the company, the owner of the store, was trying to help a customer, and I overheard the conversation. She was looking for a shampoo that was free of sodium lauryl sulfate, which is a really tough detergent that can dry out your hair. Now, because I'm so nerdy and was reading the back of the bottles, right?
Yeah.
I was like, Alan, I had that in the truck. That's Paul Brown. Let me grab it. And so you can just imagine Alan's like, who is this
Who
like
was this
black kid
guy? Yeah.
like that knows the product? And that was the day he was like, "You're not in the warehouse. I need you in the salon. You're gonna manage the inventory. You're gonna close the register. You're gonna manage the beauticians. You're gonna sweep the floors. Like you manage the office." So I was doing that on Saturdays and Sundays while I was in undergrad. And that's when I got my first raise from $6 to $8. But
Amazing.
the whole point of getting to the front of that store was maybe 2 years later. This is like 2 years later because I was now a sophomore in college. A woman came up to me and she says, "I'm curious, do you do more than this?" And it's such an interesting question.
Mm.
And I was able to tell her, yes, I do. I'm a sophomore in college at Fordham University. She asked me for my resume. The rest is history. I started out as an intern at her company that summer. Her company was Empire Blue Cross Blue Shield, Fortune 150 company. And the employee who hired me, who came into that salon and saw me for the past for how long, was the chief operating officer. And I was her first intern.
Mm.
So the lesson for me was someone's always watching you.
Yeah.
I was being watched at the dojo. I was being watched at the beauty salon. And then the second lesson is every day you're interviewing for your next job. You
Mhm.
never know. You never
Mhm.
know when you're interviewing. People turn their camera off at Zoom calls. You're interviewing, especially
Right.
if a higher up is on that Zoom call and your camera's off, they never get to see who you are.
Mhm.
Every single day you're interviewing for your next position.
Mhm. Yeah. No, thank you for sharing that story because it's it's an example of all of the best practices that you shared, right? You didn't go running to this person and say, "Hey, I heard that you might be hiring." You had started building that relationship inadvertently, but you were building it with her over the course of the 2 years. And once she realized what you were capable of, she was able to help you and provide that next step for you. And sort of the second part of the question goes back to what you were previously saying about mentorship and sponsorship. So I know that there's a difference between those two, but would love to hear from you based on your experience, how those two positions are different and how a
Yeah.
person can go about finding a sponsor or a mentor.
Yeah, mentor sponsorship's very big difference. I'm glad you brought it
Right.
up. So I talked about mentorship. You can ask anyone to be your mentor. It's good to ask someone that is on the road to where you want to be. It makes sense to ask someone, like if you're an analyst, maybe ask someone who's one or two layers above you
Right.
that is doing something you want to do. You
Mm-hmm.
can either ask someone who has the skill sets and capabilities you wish you had, or you can ask someone who's been successful and they have your same skill sets. And I'll give an example. Say you're quiet, you're an introvert, but you see a leader who's also an introvert. You might say, "Oh, I'd love for you to mentor me because I'm scared to talk, but somehow, some way you've got gained success, even though you're
Mm.
scared to talk." So so you have to pick, what type of mentorship you're looking for. But mentors are something you select. I think mentors are for a reason or a season. There should be a finite amount of time you have the mentorship relationship. It should be for something, and you have to manage that relationship.
Right.
Sponsorship is totally separate. And I
Mm-hmm.
talk about this vividly. Sponsorship is when someone decides to put their sort of expertise, their status in the company, their status in the organization on your behalf.
Mm-hmm.
And so sponsorship happens in the rooms you're not in.
Right.
So what's sponsorship? There's a project being discussed with the executive team, and they say, "Who do we think can we put on this project to help out?"
Mm-hmm.
And they'll say, "Oh, how about that kid Errol?
Mm-hmm.
I think he's a good guy. I like his work ethic, smart kid. I think this would be a great opportunity for him." That's sponsorship because it's happening in the room you're not in. You didn't even know it
Mm.
occurred.
Right.
And then you get an email and you're told that you're assigned to a project. Sometimes sponsorship you don't even know is happening, but that's why it's key to act like you're always interviewing for your next job because
Mm.
sponsors find you, you don't find them.
Mm-hmm.
And usually they put at risk their reputation for you.
Mm-hmm.
I that happened to me, my career. The chairman of the board of my current company, he recently passed away, may rest in peace, but he was very instrumental in championing my career. He would, in the rooms I wasn't in, he would
Mm.
advocate for my success. And I
Mm-hmm.
learned that he was my sponsor over time. But
Right.
sponsorship is something that you have to put yourself in a position to be found.
Mm. Yeah, that's a really good description because I think mentorship in a way can be described as like a bit more accessible, right? Because you have a bit more control over who you're choosing, how you choose to engage with them. Whereas for a sponsor, like you said in your story, you might not even know that you're being sponsored until much later on. But in this particular story of the relationship between you and the chairman of the board, how did you manage to put yourself in a position to be found and then to be sponsored? Because
Yeah,
I'm sure that's the thing that people struggle with a lot is, I want to find a sponsor, but how do I go about finding myself in that position to be sponsored?
yeah, that's a great point. So I was invited to the board to talk about the Affordable Care Act. My boss was like, Errol, you know this bill better than anyone. The board wants to understand what this is. This is Obamacare. This is back in 2014, 2013.
Mm,
I need you to present. And I was lower level staff. I didn't go to board meetings. So one, right?
right.
I had to read the bill before I even was in a position to be asked to present. That Affordable Care Act bill came out. I read all 2,000 plus pages. My boss knew I knew it through and through. He knew I
Mhm,
knew it better than anybody else. So I
mhm,
positioned myself to be ready to get that tap on the shoulder to go to the board. Then, when I was in the board meeting, I presented in a way that was clear, concise. That's what drew the chairman of the board to me in the first place. After the meeting ended, he walked over. He's like, "Young man, what's your name?" I was like,
mm.
Errol Pierre. He's like, "How long have you been here?" I recently started. He's like, "Where are you?" I was like, "I'm an assistant vice president." He's like, "I need to see more of you." Like that's how it happened. So
Mm,
again, it's like people talk about the guy in the NBA, but they never talk about the guy who was outside at midnight shooting shots.
yeah.
Like you're outside at midnight shooting shots. It prepares you for that, buzzer shot in the NBA.
Yeah. No, that's great. And it's again, I think your story kind of is very layered in a way, right? Because it wasn't just that you put yourself in a position of being a subject matter expert, it was also that your manager recognized that about you and recommended your name for you to go and speak to that particular audience. So it's interesting how like you can do one thing, but that can cause a cascading effect that could then put you in a position to be sponsored, mentored, promoted, whatever the case may be.
And if I can just add something to that,
Yeah.
many people I speak to, because people reach out on LinkedIn for career advice, they're looking for titles.
Mm,
And I always recommend you look for roles and you look for bosses. All the trajectory in my career happened under bosses that believed in me and happened into roles that were built for my success. I was the chief operating officer of a very big insurance company. I'm no longer there. The title sounded great. I hated the role. So I chased
mm,
the title. It was not a good idea. That's my like first chapter, my resignation letter, right? Um, but I chased a role. I'm a senior vice president now. Someone might say, "Oh, you took a step back." No, I am in the best job I've ever had. It's made for me.
mm,
So it was role based, and I have an amazing leader. I have an amazing leader and an amazing role. So don't chase titles. It's does the role match your skill set and your capabilities, and does your boss going to invest in your career? Because if I had the wrong boss, they would have never brought me to the board meeting.
mm. Yeah, that's a really, really good point. It's like, how are you structuring your journey, your career journey, and using this idea of the actual work that you'll be doing and the people that you'll be working with as a foundation. It sounds really important. It sounds like it's been very pivotal for your career, which has been great. The other thing I wanted to mention was just how interestingly and uniquely your book is structured. So you just mentioned you kind of start off by talking about your resignation as a COO and then stepping into this new role. And you obviously share a lot of your personal stories, like the one about the shampoo bottles, but you also had the opportunity to speak with leaders of color from within healthcare and outside of healthcare and pepper in some of their stories as well. And I wanted to ask you what you learned from that experience, structuring the book in that very intentional way of not just what you've learned, but also what they've learned.
Yeah, thank you so much. So always say the book was written three times. The first way is my personal story. And unfortunately, in our society, if you're just an N of one, people don't believe you. They're like, "Oh, Errol, you just got lucky,"
He's a
or
unicorn.
"Oh,
Yeah.
yeah, you're an anomaly," oh, whatever. And so I thought it was very important for me to speak to 11 other executives of color and ask their story. And ironically, the stories were so similar.
Mm-hmm.
Change the name, change the color of skin, change the place of birth, but the stories were exactly similar. And so that was powerful for me that it resonated, that my anecdotal story was very similar to other people that had totally different backgrounds, men
Mm-hmm.
and women, right? And so
Mm-hmm.
that was just awesome. And I got to speak to some amazing people. Chief Diversity Officer of American Express, um, Dr. Toyina Ajayi, she runs City Block, like a multi-billion-dollar company. So it was just amazing. So that's the second way I wrote the story, was
Mm,
talking to 11 executives of color. The third way was facts, figures, and research. And
right.
so I'm an academic, right? I got a doctorate degree for a reason. And so I felt compelled to not just have my anecdotal stories with their anecdotal stories, but back it up with numbers, facts,
Mhm.
figures, and statistics. And so there's so much research in the book that backs up the anecdotal stories. Because what happens is people hear a story and they say, that's just you. Then they
Yeah.
see stats, and when you hear 25% of, oh, when you hear the stat like there's only 6% of Black CEOs in Fortune 500, they can't put
Mm.
a face to the name. 6% doesn't mean anything to them. So this mirrored the two. I have facts, figures, data, research, and anecdotal stories and brought it together.
Mhm. Yeah, and like you said, there's power in numbers, right? Not just the facts and figures, but just power in the number of anecdotal stories and the variety of the people that you spoke with as well. So another question that I had for you, because you talked about, being intentional about interviewing other leaders of color for your book, is we're in this environment now where uh, there's been a lot of attack on terms like DEI, critical race theory. We've seen a lot of programs such as affirmative action be shot down. Anything that's really dedicated to diversifying and making the workplace more equitable, both within healthcare and outside of healthcare. So it would be great to hear from you, like what your thoughts are on the
Yeah.
current environment and where we might be heading as far as making sure that our workplaces are as diverse as possible.
Yeah, it's a great question, hard question.
Yeah,
And I should have said this in the beginning, but everything I'm saying, thoughts are my own. I represent
of
no one,
course.
just
You represent
so
yourself. Yeah,
then that can actually be real when I answer. Okay, so um, DEI, these three letters right now, they're bad words, right?
right.
So I stopped using the acronym. I actually say the whole phrase out loud because you ask someone, are you against diversity? High likelihood they would say no. Are you against equity? High likelihood they would say no. Are you against inclusion? High
Hmm.
likelihood they would say no. So people are against DEI, I'm using air quotes,
Right.
but many of those but what are they actually against? Because they're not against the individual words individually. They're against
Mm,
this term DEI. So DEI has now been framed as people gaining roles, promotions, perks solely on the basis of their skin color in order to have every position in America match our demographics. Like 12% of the country is African American, so
right.
12% of the doctors should be African American. I don't think that was the original intent, right? The original
Right.
intent came about after civil rights, looking around and saying we're missing millions and millions of very talented people due to our own bias,
Hmm.
and we're not giving them a shot. You know, ironically, it's hard to believe, right? A black kid in the Bronx stocking shelves could be a COO. So we were
Right.
missing these opportunities. So DEI was always about merit, always about merit. And it was trying to find a hidden talent among us that weren't
Hmm.
getting the right roles. There are millions of people today, some are on the call, that are in roles beneath their intelligence, beneath their capabilities, and beneath their
Hmm.
talents. And so they suffer from getting less income than they should. There's so much inefficiency. So
Yeah.
to me, DEI has to be reframed as maximizing employment placement, whereby you hire the best people for the role in the way that controls for bias. So the best talent finds its way to the top. And that
Mm,
means we need different tools, right? I didn't go to
yeah.
Harvard, but
Right.
I may be better for a role than a Harvard graduate. So we need
Right.
different tools to assess like who's the right person. And how do we uncover this nuance? And so the original intent of DEI to me was something I would coin the phrase ember. You're like ember, what is it, right? MBUH, EMBA,
Hmm.
merit-based unbiased hiring and retention.
Hmm.
Merit-based unbiased hiring and retention. DEI was always merit-based, unbiased hiring and retention. And I think that's the way we have to reframe it.
Yeah, no, I really appreciate that. And I think, again, the sort of the through line from this entire conversation has been intention, right? So even now, when we're thinking about the language that we're using, when we're talking about topics like diversity, equity, and inclusion, like, are you actually using those words? Are you using DEI? If you're using one word versus the other, how is that going to impact your interactions with people and the point that you want to get across? So I appreciate that. And I appreciate you highlighting what the quote unquote original intention is, right? Of DEI, it's really just righting the wrongs of the past when, folks for such a long time weren't able to access education, opportunities, and all of the things that come with becoming successful. How do we course correct for centuries of that being intentionally in place? So it's really important, and thank you for taking us back to why we have it in the first place. That's really, really important. So to kind of switch gears a little bit, wanted to ask you, you do a lot, which we talked about at the beginning of the call. You teach classes, you give talks like this, you have a day job. So what does self-care look like for you? And is there such a thing as work-life balance or work-life integration?
Yeah, I'm gonna be probably on the wrong end of this, but my this is my perspective. You could take with it how you will, but um, the concept of self-care and work-life balance assumes that when you're not doing self-care activities, you're like not taking care of yourself. And work-life balance means like when you're at work, you're not living life. That's the way I
Mm,
take it, right? Oh,
yeah,
work-life balance. That means when I'm at work, I'm not li living. And
right.
self-care, which means when I'm not doing self-care, I'm not taking care of myself. So I don't live that way. So when people are like, how do you do all these things? To me, they're all connected.
Mm,
Uh, I love, I am passionate about healthcare. I'm passionate about uh, uh, decreasing disparities. I'm passionate about making sure everyone gets the highest quality healthcare, regardless of age, creed, color, race, where they're from, their zip code. That's my passion. The passion shows itself in my day job. The passion shows itself in me teaching students because I want the next generation of students to come into healthcare ready to
mm,
fix all the ills that we have. So I'm
yeah,
like, let me go to root cause, let me go upstream and train the future leaders. That's why I teach. And then
yeah.
the boards I'm on are related to healthcare. So I don't feel like I'm working. I'm
Yeah.
like, even though I'm always working. So to me, this is like living my passion, it's living my purpose. So when people are like, oh, when do you have work-life balance? Like this call right now energizes me. When I teach, it
Mm,
energizes me. When I volunteer with the boards I work with, it energizes me. I'm being energized by this work. It's not something I need a break from. I don't need a
mhm.
break from it. I want to do more of it.
Hmm. No, I appreciate that. And it sounds like, for you, being able to integrate your passions with your day to day is how you take care of yourself. And that's, if you're not taking care of yourself by engaging yourself intellectually or by figuring out what your intentions are and aligning them with your actions, then you're really not pursuing that self care and taking care of yourself in that meaningful way. The other question I wanted to ask you is going back to your story about having read the 2000 plus pages of the Affordable Care Act and becoming the ACA guy at your company. Wanted to ask you what direction you think healthcare is going now. We talked a little about your thoughts on DEI and and diversity of the workplace, but by that same token, what direction do we think healthcare is moving in, especially given a lot of reduction in workforce as it relates to the HHS federally, and just we've seen a lot of cuts and a lot of demoralization of folks who work in the public health and the healthcare space. So curious to hear your thoughts on the direction that we're headed.
Yep. And I'll pontificate. I don't have a crystal ball.
Yeah.
So this is as good as right now, today at
Hmm.
6:09 p.m.
We'll take
So I
it.
think this is what I would say. We're at an inflection point in our country because we have a two-tiered healthcare system that we have yet to admit. The two-tiered healthcare system is half of America, 150 million people, are able to get their care through private commercial insurance, through the
Right.
big payers, for-profit payers. The other half of the country is getting it through public means, Medicaid, Medicare, right? The commercial private payers pay a higher reimbursement rate for those services,
Right.
sometimes upwards of 200, 300% of Medicare, where the government plans pay, it's good news if they pay 100% of the rate. You might get less, right? Medicaid, potentially you get 70 cents on the dollar, where private insurance, you're getting, multiples, right? So what we've created is people's healthcare is based on reimbursement. So
Hmm.
Medicaid patients asking to see a cardiologist or asking to see a behavioral health specialist, that doctor, because they run a business and have to pay the bills and costs are going up, has to now decide when do I see this Medicaid patient that I potentially will lose money on or only get
Mm,
70% of the revenue I need to run it? And so that pushes out access. I'm not going to see the patient next week. I'll see the patient in 3 months, 4 months, because the reimbursement's so low. Meanwhile, the person on private insurance, when they call up, I want to see you tomorrow because I can get a higher reimbursement. That's the system we've literally created. So
right.
now in Congress, they're trying to figure out how to cut our expenses. Any expenses, whether it's Medicaid cuts, Medicare cuts, whatever they do, it's actually going to hurt the people that are the most vulnerable. The people that need the care the most, that already aren't getting access as fast as they need, are going to be the ones that are in
Fall
the
behind.
lurch, which is
Yeah.
unfortunate. So we're going to exacerbate this two-tier system. My hope is that, as a kid, my mom would tell me, don't touch the stove, it's hot. Don't touch the stove, it's hot. Errol, don't touch the stove, it's hot. I didn't learn that the stove was hot until I touched it. I had to touch it. My
Right.
hope is we're going to pass policy that will teach people that the policy was hot. They'll say, oh, wow, I'm losing Medicaid. I'm hardworking. How come I got kicked off? The
Mm,
hospital is going to say, we have more uninsured folks. Now we still have to take care of them. I can't close my door. So I
right.
still have to take care of them, but now they're not insured. And so we're going to learn what these policies mean. I think very quickly we're going to remove our hand from the stove and revert back. The policies kind of are going to get us back to a place like pre-ACA. If
Yeah.
people remember 2013, the uninsured rate in the country was 10 to 15%. We got down nationally to 6%. So it is more expensive. We're covering more people. But if we do all these unwinds, we're going to get back to 12 to 15%, and people are going to remember what it felt like back then, right? Maybe we
Mm,
have memory that lasts 10 years, right? So we've kind of forgot 2012, but
yeah.
quickly we will remember the importance of healthcare, and I think it will boomerang back. So these are cycles that we have to go through.
Yeah.
I think we just have to strap in and take care of our most vulnerable folks to make sure that they get the care they need.
Yeah. No, you're absolutely right. And I appreciate what you were saying about, short-term memory really, which is that, the reason that we have the healthcare system that we have was because of such a reluctance to adopt universal healthcare post World War II. The UK developed the NHS and we said we don't want that and we're still living with the consequences of that. So I appreciate your perspective on that. We are at the end of our formal time together, but do you have any last insights that you'd like to share with the group before we turn it over to Q&A?
Yes, I have one slide I'd love to share with everyone. As a professor, you always have to have a slide. So this
Yeah.
is like part and parcel. Okay, so if you can see the screen, you'll see a graph that kind of lays out what level you are in the company. If you're the C-suite or entry level, that's on the left side. And then what's your level of authenticity? Are you most authentic or you're least authentic? And then obviously there's a glass ceiling. And I have yet to crash through the glass ceiling, right? I have yet to do that, but I'm still trying. And so if you press down, go forward, the way up, my book talked about my journey to hit my head up against the glass ceiling. I hit my head up against it. And you can see how I raised up the ranks. That's great. But I also lost my most authentic self. And so the way up only gets you halfway there. My hope for all of you that joined the call, and I'm so appreciative people joined, is if you go to the next one, that you not only surpass and break through the glass ceiling, shatter it, but you find the way back to your authentic self. And that's my wish for all of you. Thank you.
Thank you so much for that, Errol. And as always, we love a good slide with some good animation. So thanks for sharing that with us. I'll transition things over to Marjo, who will lead us through some Q&A.
All right, we've got a couple of questions here in the chat, so I'm going to read a few. The first question for you, Errol, is what was a negative experience you encountered that ended up being for the best, and how did you overcome that hardship?
Yeah, it's a great question. So my biggest failure in my career was a launch of a product. I was at Blue Cross Blue Shield that flopped. It was a total flop, and I was the head analyst consultant on the project. And it was a failure because we priced it wrong. So too many people enrolled. but the revenue didn't cover the cost. And so something called adverse selection, and we had to basically withdraw the product from the market. And it was my big like chance to launch a project, and it was a absolute failure. So why why do I say that as good news? One, it's great to fail because you learn, right? So it's good to get your knees scratched, pick yourself up, dust off yourself. You find out you didn't die, you keep moving. That was the first piece. But the second piece, the best lesson I learned was I wasn't as bad as my worst day. I failed, but I got back up and tried again. You're not as bad as your worst day. And then to keep yourself humble is you're also not as good as your best day. So there's going to be a day where you kill it, you murdered it, you did the board meeting and people thought it was amazing. And you can't let it get to your head. You cannot be arrogant. So you're not as good as your worst day, but you're also not as bad as I'm sorry, you're not as bad as your worst day, but you're not as good as your best day.
Great, thank you for that. Another question is, what inspired you to write your book and how did you get started? Were
Oh,
there
good
any
question.
people or moments along the way that helped you shape or support your process?
Yeah. So honestly, I wrote the book in COVID. So this is the joke I tell. COVID started in New York in March, like mid-March, March 17th. By June, I watched everything on Netflix from A to Z, and I was like really bored. And so I was like, what's next? Um, June was the height of Black Lives Matter. People were protesting in the streets. And I was like, I'm not going to protest, ironically. I work for a healthcare company. I'm trying to keep COVID rates low. The concept of me being outside during the pandemic, it just didn't sit right with me. So it's like, how can I protest? What's my ability in Black Lives Matter to give back to my community? And so stayed inside, but then that's where the book came from. I was like, the least I can do is talk about my journey climbing the corporate mountain. I call it a mountain, not a ladder, because it's not a straight line up. Because so many people have asked me for career advice, and I realized I was repeating the same stories over and over. I was like, I got to put this down on paper and reach more people. So that's what really inspired it. It was my way to protest. And so I didn't have a picket sign on the streets during Black Lives Matter. I was at home writing chapters. That was my way to kind of protest and support the Black Lives Matter movement.
Perfect. We have a couple of questions here regarding mentorship. Do you have any suggestions for finding a mentor?
Yes, ask for a 30-minute Zoom chat and ask them to ask the person you invited to tell them about their career and what lessons they learned along the way. Some people get so consumed with nervousness of trying to ask if someone's going to be their mentor. It's not like getting married. Like you don't have to get engaged. Like literally, someone's interesting. They said something that was, inspiring. Reach out to them, say, hi, you said something that really, moved me. I'd love 15, 30 minutes. Can we do a Zoom chat? I just want to ask you more questions. Ask them questions. The people love to talk about themselves. And that's how you start out. That first 30 minutes, you'll know if you like them or not, right? You either jive or you don't. If it goes well, say, this was amazing. Do you think in a month I can reach out for another 30 minutes? And they might say yes or no. The worst they can say is no. And you build it from there. Be intentional about why you're talking to them. Set an agenda in advance. You're in a mentorship program, right? That's how easy it is. You don't have to make this like a big thing. It doesn't have to be so official. It's more just reaching out, getting coffee, or getting a 30-minute Zoom conversation.
And we'll take one last question. And this is, when is the next book?
That's a great question. So, pandemics happen every 100 years. My next book is probably going to be in 100 years because I need to be at home for 2 years to write it. No, I've been thinking about what to write about. I just have to find the time. I have to find the time.
Great. Thank you so much. Anja, and I'll kick it back over to you.
Great. Thank you so much for that, Marjo. I do think we actually have time for one more question, so I'm going to sneak in and add one here if that's okay, Marjo.
Sure, go
As
ahead.
long as it's easy, as long as it's easy.
Yeah, I mean, I think so, but this last question is pretty thought-provoking, but should be easy to answer. What do you think made the woman at the beauty store come up to you and ask, "Is this all you do?" How did you position yourself in that way that she even noticed you?
Yeah, yeah, I think about that all the time. I actually got to ask her this question. She recently retired from a very big job at another big health insurance company. She said, even though it was shampoo, you treated it so seriously. Like the bottles all they were facing forward. You were elegant with the staff. You treated the role with respect. And she's like, if he
Mm.
can do that with shampoo, then I'll take it. I'll take it. And it was a sharp contrast to my other coworkers. So the other coworkers, they were like on their phone, doing other things, doing their hair, they just weren't as focused. And she's just like, there's just a dutifulness, which I learned from my dad, a dutifulness about him. It's shampoo, but he's treating it like it's $100 bills. And I think that's what set me apart.
That's really beautiful, and thanks for bringing it back to the work ethic that you learned from your parents because, just because you learned some new lessons when you started your journey in corporate America doesn't mean that, that whatever your parents taught you wasn't relevant anymore. So thanks for rounding that out for us. That's all the time we have today for our conversation with Errol Pierre. Thanks again, Errol, for taking the time to join us and sharing some insights. And thank you, Marjo, for so expertly manning the Q&A chat portion of the event. We'll kick things over now to Halim to talk a little bit about our upcoming events.
Thank you, everyone. So while the slide is up, I'd like to just progress to the QR code for our survey, and I'd like to ask everyone while we're making the closing remarks, if you could just take a moment to provide feedback on tonight's session, it would be greatly appreciated. It helps us make sure that we're providing the content and the type of programs that our membership is looking for. Can you pull that QR code up? Or do we have the survey? So while they're looking for that, there's a couple of key takeaways. I was actually one of the few people that I was actually pretty privileged to get Errol's book from Lenny Achen over at Live On. I was a part of the cohort that was able to benefit from having the sponsors and the mentorship program. And one of the things that we were able to do as a participant in that was get a copy of Errol's book. And the one thing I like hearing from people and leaders like Errol is that a lot of the lessons that I've learned along the way and people that have mentored me, sponsored me, and supported me throughout my professional development, they continue to be repeated by successful leaders. It's not something that was just a one-off bit of advice along the way. And, there are a couple of key takeaways in this particular instance. And one thing we're looking at is just like, don't be another face in the crowd. Don't be someone that's just going to sit and blend in with everybody else. The people that are successful, that have climbed that ladder and made a meaningful impact within the organizations that they work for, they have stood out. Another thing that I take with me from this is about the relationship building process. And just form a relationship with someone for the sake of the relationship. I was looking at the comments in the chat and you can see that, people talk about, it's what you get, there's something you can get later on from it. It doesn't matter whether you get something or not. It may be something that you can give to the other person with that relationship that is value. So it's not necessarily about what you can receive, it's about what you can give. And the last thing, you know, um, everybody's got a story to tell about their past and the road and the journey that they've taken. And, the shampoo bottles with Errol, working in the city, and at least I start to reflect on some of my journeys working with my parents when my father came into this country, when he was 19 years old. It's never downplay your role. Never downplay your role because you never know the importance that your role has in someone else's life. Whether it be someone who's maintaining the order and cleanliness of a bathroom in a restaurant, or serving French fries at McDonald's, or welcoming somebody into Walmart. Not shameless plugs for any of those companies, by the way. But it's never ever underestimate those interactions that you have, regardless of that role that you're in at that current moment. So, and that's all a part of the growth process. So once again, thank you to Marjorie and Angela for putting together this excellent session for all of our participants. And of course, Errol, it's never a disappointing moment when our organization is able to hear you share your words of wisdom with us. So again, thank you once so much for everything that you do for us and supporting the development of healthcare leaders. If we can slide on to the next slide, please. So this is a qualifying event. So for those of us that have an ACHE account and are looking to keep track of our events, this is a self-report event. So you'd have to go onto myache.org and self-report this qualifying education event. Be sure to put down the full title of this event for yourself as well. If there's any questions, don't hesitate to reach out to our programs committee to help you with navigating that part of the process. Next slide, please. So what we have some very important events coming up. I believe it's next week. We have our HEN committee sponsoring and leading the navigating the transition from fellowship to early career success, which is a virtual event. There's an amazing social networking event that our membership committee put together. It is going to be taking place July 8th in one of my favorite places in New York, Yankee Stadium. So July 8th, 7:05 p.m., the Yankees will be hosting the Seattle Mariners in the Bronx. So there is it has not been officially posted yet because our membership co-chairs were just able to iron out the details yesterday. But please be sure to take a look at our hlny.org website when it's posted and register. There is a special section reserved for us, section 232A, right behind the Stella Artois section. Again, not another sandwich plug for another company. But the tickets are $40 plus taxes and fees. And I believe it's like $47.44 per ticket. The next event that we have coming after that is on July 10th, the lessons learned in supporting healthcare worker mental health and resilience. And one of our favorite events coming up after that, wrapping up July, is our 13th Past President's Boat Cruise. That event will sell out quickly, so that event is posted now. Please be sure to reserve your tickets now and save your spot for this event. Some other events that we have coming up. One of our big signature events is October 22nd for HLNY's mini Congress. It will be at the New York Academy of Medicine. Our speakers and panelists have yet to be determined, but we are definitely looking forward to making sure that we will be offering credits. We have to just get approval from ACHE for that. And then in November, we have our Frank Camerano dinner at St. John's University. And then we'll wrap up our year with our annual holiday party at Terrace on the Park in December. Also, on August 14th, we have our Better Together event coming up. That event will be taking place at the company. It will be posted up on our website soon, so be sure to register and purchase your tickets for that event as well. If you can go to the next slide, please. Again, this is talking about our July 8th membership mixer at the Bronx. This is open for members and non-members. So feel free to bring a friend, a spouse, anybody, a partner, anybody that you want. If you are not a Yankees fan, please don't sit next to me at Yankee Stadium. I am a hardcore Yankees fan, and I don't know how our membership team pulled this off, but they pulled it off. So thank you. Next slide, please. And be sure to register for all of our HLNY events by going to our website and subscribe to our events calendar. Next slide. As we're wrapping up the month of June, there are only a few days left to have the exam fees waived for you to ensure that you get your FACHI. So if you're ready to sit for your Board of Governors exam, please take advantage of this opportunity. If there's any questions or concerns, feel free to reach out to our advancement chairs, Ben and Navish, at advancement@hlny.org. Next slide, please. The HLNY Foundation continues to support tomorrow's future healthcare leaders, and they hold a lot of scholarships for a lot of people who are interested in receiving the scholarship dollars to help them in their professional development. So you can scan to donate to the HLNY Foundation, or you can go to the foundation website as well. Next slide. And this event, along with all of our other events, are due in large part to all of our sponsors. They help support the development of future healthcare leaders and their professional development, as well as our current healthcare leaders to continue that we stay on the cutting edge of our profession. And that we have one more slide after this. And if you are interested in becoming a sponsor and getting your company's logo on our banner, please feel free to reach out to sponsors at hlny.org. I believe that is all for today. We are 1 minute over time. And here's our social media links on LinkedIn and YouTube. We are also on Instagram. Uh, anything else? Any other slides after this? That's it. I think we're done. So thanks again, everybody, once again, for all of your support of our programs. Errol, thank you for a wonderful session tonight. Angela and Marjorie for helping support this. Have a good night, everyone. Take care.
Thanks, everyone. Good night.
Bye-bye.